So one of the most sought after things in the world this year has been a vaccine to COVID-19. Obviously, the global pandemic has been probably the biggest thing that's happened this year. It's been terrible, right? We've had to deal with a lot of horrible things because of this year, and I think it's something that we're all ready to move past. You know what I'm saying? I think we all kind of want to get to what people are calling like a new normal, where I don't think everything is ever going to go back to the way that it was before or anything crazy, but we're all just ready to get back to a point where, it seems normal, right? Where it seems okay, right? Now, thankfully, there's been more good news in the entire COVID-19 vaccine situation. It's been something that's been developing pretty much ever since the pandemic started. And we're finally starting to see the fruits of scientists' labor from all these different companies and pharmaceutical places and things like that. And it seems like, hopefully, quite soon, we'll actually be seeing implementations of the vaccine to try and slow and curb this pandemic and to get the entire world back on track. Now, just a few days ago, I made a video talking about a vaccine that showed a very high success rate in its clinical trials, and they were trying to push that forward and make everything go faster and get it out faster. Now, even more good news has come out, especially here in the United States, where the vaccine race is basically in full effect with just so many different companies trying to work on a vaccine and get a product out to the public. So two major pharmaceutical companies here in the United States say that they will be submitting to the U.S. Food and Drug Administration today for an emergency use authorization for their coronavirus vaccine candidates, which marks the first time in the United States that a coronavirus vaccine has sought regulatory okays to basically start moving forward and getting this into people's hands. Now, this vaccine candidate is called BNT162b2. I know that's confusing. That really doesn't make sense to most people, but this vaccine candidate, according to these companies, will be potentially available for use in high-risk populations in the United States by the middle to the end of December. And the vaccine requires 2 doses a few weeks apart, and protection is achieved 28 days after the first shot. So hopefully by middle to end of December 2020, the elderly, people who are already sick with compromised immune systems, people in high-risk locations, will start to be able to finally get the COVID vaccine that we've all been looking for. Now, there's been several different vaccines now that have, started up and been developed that are showing very high rates of success, usually over 90%, which is pretty good. Those numbers are never final or anything because there's still more testing to go, and obviously they have to implement it and things like that, but it's still very promising news to see several vaccine candidates doing so well. As a matter of fact, their final analysis from the trial for this coronavirus vaccine was 95% effective in preventing infections, even in older adults, obviously with weaker immune systems, and that they know of caused no serious safety concerns. This submission even included safety data on about 100 children ages 12 to 15, so they tried to, pull people from different age ranges, groups, and things like that to try and, see how this is going to affect the wider general population, because obviously with a vaccine, you don't want to just make it for people who are high risk, right? You don't want to make it for just people who probably could get it if they were close enough, or people that if they did get it would die, you know what I'm saying? It has to be developed to a point where everyone can get it. And about 42% of global participants and 30% of US participants in the phase 3 study have racially and ethnically diverse backgrounds. And in a news release, they said that 41% of global and 45% of US participants were ages 56 to 85. So they're really trying to get the whole umbrella and everything. They're trying to get this out to the general public once again, but they're also trying to focus on those higher age ranges. A big thing with COVID that I think a lot of people forget is how the older you get, generally speaking, the deadlier that it really gets. Because younger people, obviously, their bodies are fresher, I guess is a good way to put it. They have better immune systems most of the time. The older you get, man, the harder it is for your body to keep up. Your immune system weakens and things like that. So it can become a problem if you get something like COVID and you're in that kind of situation, right? So the thing is, though, emergency use authorization from the FDA, it's not the same thing as a full approval, okay? So basically, emergency use authorizations, they allow products to be used under, very specific circumstances. They usually call these EUAs, right? Now, if an EUA is issued, that's pretty rare, you know what I'm saying? Especially in a situation like this, because obviously it's such a big deal. So an EUA here would probably be appropriate because, this is a situation in which the world really can't afford another, wait 2, 3, 6 months or whatever to get this going through at the normal speed. Hundreds of thousands, if not millions of people can die in that time frame. So, this is something that has to be done now. And it doesn't guarantee that this is going to, I guess, get authorized or whatever, but full approval basically is a lot different, okay? Now, for this EUA, the agency will determine whether or not a product's known and potential benefits outweigh the known and potential risks, which from my personal opinion here, I think that this is a situation in which the benefits are going to outweigh the risks, because considering the fact that they've found a 95% effectiveness rating, there's no serious health consequences to taking this that they know of, after all this research and whatnot, it's a situation in which it's like, we really don't have time to play around, and it is pretty safe and it's pretty effective. I'm pretty sure we're going to end up seeing this get EUA'd. This is probably going to be pushed through as fast as possible, which is a good thing. At least in my opinion, it's still a good thing if we get this out as quickly as possible. But of course, like I said, there's been these other candidates, right? There's other companies that are also working on COVID vaccines, and recently, actually, just Monday, Moderna, another pharmaceutical company, announced that their early clinical trial results showed that their vaccine was 94.5% effective, meaning that all these companies, they're doing really well with their vaccines. They're actually getting these things super effective, they're making them safe, and they're doing it at a record pace in all reality. I mean, you gotta think, COVID's really been like a big deal globally since like, what, January, February? It really hasn't been that long. It hasn't been a full year. And we're talking about super effective, hopefully virus-stopping vaccines that are maybe hitting the shelves even as early as next month. And their company, Moderna, of course, plans to apply to the FDA for authorization after it accumulates more safety data later this month. So they're, still getting everything together. They're still trying to figure out their final case before they push for their approval. I don't know if they're going to approve multiple vaccines at once. I would assume that they probably will, especially if they're all safe and effective, so that there's more doses of vaccinations out there to treat, obviously, a larger number of people, as quickly as possible. Because this, I can't stress enough, is a situation in which we can't really pussyfoot around, you know what I'm saying? Like, the world can't sit around on its hands just waiting for this to work out. This is something that everyone has to come together on and kind of just face head on. So I would think that multiple vaccines would probably come out at the same time, or, within a relatively similar time frame and whatnot. But the FDA has scheduled a meeting of the Vaccines and Related Biological Products Advisory Committee, that's a fucking mouthful, which is a group of experts for December 8th through 10th. And they could make a decision at the end of the meeting on the 10th about whether or not to issue an emergency use authorization. This is in December. Now, the thing is the Pfizer and Moderna vaccines, they use the same technology, and the data is extremely similar. So if one gets approved, I'd say it's pretty likely the other also gets approved, maybe even at the same time. And if one gets rejected, there's also a pretty good chance the other one gets rejected, which would be bad, right? Because that means we have to wait longer to get the vaccine out there and to start treating people and things like that. So if this is getting EUA'd, right, that would mean that immediately it can start to get distributed to states and to hospitals and whatnot, and they can start getting this ready to roll. But the thing is, no one can be vaccinated until the CDC Advisory Committee reviews the data, recommends the vaccine, and then they'll decide which groups receive it first. Most likely, immunocompromised people, the elderly, people in high-risk locations, things like that, right? So if the FDA basically authorizes this, they EUA it, that means that this advisory committee will actually end up meeting within, 1 to 2 days or so afterwards. They'll determine if some people should be excluded, probably based on health risks, which there doesn't really appear to be any. And then once the ACIP issues recommendations, that's when vaccinations can start to be given. And then after that, it takes a month, of course, for it to really become effective and whatnot after the shots. And at that point is when we'll start to see people become vaccinated against COVID, which means at the earliest, early February, very late January maybe, we can start to see people actually getting vaccinated against COVID, which would be amazing because this has been a world-changing situation. It's been absolutely terrible this year. And a lot of that really has to do with this whole pandemic, man. I think we're all about tired of it, and I think we're all ready to just kind of move on and get this all over with. And these are the first real steps, it seems, that we're actually taking to getting this all said and done, you know what I'm saying? Getting this all over with, because the lockdowns and everything didn't really work. We're still seeing record cases in a lot of places. A lot of people aren't paying attention anymore, and obviously that's not good. So with all that being said, though, thank you guys for watching. If you did enjoy, make sure to leave a like, subscribe if you're brand new around here on the channel. Follow me over on Twitter and Twitch at SubToOptimus. Make sure to check out Shop Opti down below. Thank you to my channel members. Your support helps my channel tremendously. And until my next video, guys, this is Optimus, talking about COVID vaccines, and signing out.